Good afternoon, and thank you for joining us. My name is Tina Tebow, and I will be your moderator for this afternoon's news conference. Joining us today, the Honourable Steve McNeil, Premier of the Province of Nova Scotia, and Dr. Robert Strang, Chief Medical Officer of Health for Nova Scotia. Go ahead, Premier.
Thank you, Tina. Dr. Strang will now bring us up to date on COVID-19 cases in Nova Scotia.
Thank you, Premier. Today we're announcing 32 new cases of COVID-19, bringing the total number of confirmed cases in Nova Scotia to 342. There are currently 11 individuals in hospital, 5 of those in the ICU, and the other 4 are in don't require that intensive level of care. 72 people have recovered, which is really good news. To date, we've had 11,346 Nova Scotians tested and have had negative results. Now that we have removed travel from the screening requirements, and I'll expand upon that in just a minute, we certainly going to expect that more and more Nova Scotians will meet the criteria for testing, and that's actually a good news. One of the key pieces, as you've heard me talk about this, is that we need to have a low threshold of testing people, and if they're positive, we work closely with them to have them isolated, work with their close contacts, have those contacts isolated. That's one of the key reasons of how we break the cycle of transmission by having that rapid or broad access to testing and rapid follow-up. With the elimination of travel, we have expanded the list of symptoms that we are using for screening for COVID-19. And this is based on, as we get more and more experience globally as well as in Canada, understanding what are the symptoms that people with COVID-19 are likely to present with. Initially, when we did our screening, we had travel along with a history of a fever or cough. Now, if people are concerned and they have COVID and they go to the online 811 website or screenings happening at other places potentially, we're looking at the symptoms are fever, new or worsening cough, headache, sore throat, and runny nose. If people have 2 or more of those symptoms, there's a possibility they may have COVID infection, and we want them, those are the people we're looking to be tested. So again, the process is if people are concerned that they may have COVID infection, if at all possible, if they have access to the internet, going on to the 811 website, doing their online screening, and then they'll be directed for further telephone screening and then possibly testing as necessary through that online assessment. Know that some Nova Scotians don't have that, so if you don't have access to the online, by all means call 811, but if at all possible, do the online screening first. And as you've heard me talk about, we've substantially built our capacity in the lab. We've built our capacity and the ability to manage people and test them through the assessment center, and that we have public health staff have all been deployed. Really, the only piece of work now that's happening through public health is following up of cases. We also follow up all the negative cases to make sure they get informed of the result and have an opportunity to ask any questions they may have and further direction they may need. I spoke initially when we first started testing for COVID-19 in Nova Scotia that when we have information to share with the public, you will hear directly from us through these daily briefings. I want people to understand that because we continue to have questions about rumors about this case or rumors about this death, that please use this place, these daily briefings, as well as our online website where we have information as the source of truth around COVID-19. We have a process that all the information about new cases and any deaths that may occur, that local public health has all that information. It is passed into the epidemiologists in the department, usually by early morning. Those numbers are the numbers that we use for our that are made public on our website, and they're the numbers we use at these 3 o'clock daily briefings. things may happen later on in the morning or even in the early afternoon each day that people may hear about, but we have not had a chance to do the work within public health to follow up a case or to validate and investigate a case or even a death to make sure that they are actually related to COVID. So we would not talk about those until they were confirmed, and they would likely be included in the numbers in the next day. I'm focusing on this because it's important that we don't, and I think the media has to understand this and play a role in this. We don't want unnecessary, unvalidated rumors about somebody having COVID-19 or even somebody may have died of COVID-19 circulating around. We need to respect families that are dealing with difficult information potentially. When the information is investigated and validated, you will hear it here, and it will be on our website. I'm just going to finish off today with a couple of things. First of all, I'm going to say it's concerning to me. I was made aware just earlier this afternoon that 911 is still getting calls from the public who are saying they have COVID symptoms, thinking that somehow if they say they have COVID, they're going to get faster attention from 911. And then when 911 shows up, increased anxiety on the part of the crew. They've donned their special protective equipment. Lo and behold, they show up and the person said, well, they don't actually have COVID-19 symptoms. They just thought they'd get faster attention. That has to stop. 911 has a process that people will be triaged no matter what symptoms they have and get in the timely attention that they need based on the urgency of their symptoms. Saying you have COVID will not assure you in any way that you're going to get faster attention, and it causes unnecessary anxiety to the THS crews, and it's a waste of resources of precious personal protective equipment in our healthcare system. Please, public, I know the vast majority of you do, but all of the public, we need to act responsibly. And if you need help from the healthcare system, whether it's 911, 811, or wherever, be honest about the symptoms. You will get the attention you need in the time you need it based on the urgency of your situation. And you don't need to use COVID as thinking that you're somehow going to get more attention or faster attention than you will. It's unfortunate that I have to say this. I almost have to shake my head thinking I have to talk about this publicly, but it's happening enough that I feel I need to, and we need everybody to act responsibly. With that, I'll finish off that I know it's Wednesday now. We're heading into the Easter weekend. That is an important weekend for many people. It is going to be very different this year. I acknowledge that, and it's going to present some different challenges on how we celebrate the Easter weekend, and 4 days for families that are going to look very different than we normally do. However, despite those challenges, those difficulties, it's really important that we need to continue to stay together, working together, following the public health measures that you hear me saying over and over again, practicing good hand washing, personal hygiene, staying home as much as possible, only going out for essential trips, not engaging with the rest of your community unless it's necessary, and in doing so in groups of five or less. It's critically important that over the next few weeks that we all stick with this. And if we do this, we will get through the Easter weekend. We will also get through the next few weeks and come out of this in a brighter side as quickly as we're able to.
Thank you, Dr. Strang. That's a new tie there today, I believe.
That was Dr. Jock Murray sent that to me. I got it yesterday, and I want to thank you for recognizing it, and thank you, Dr. Murray, for sending me this new physician-oriented tie.
It was the second best tie you've worn so far since we've been here. I think the Montreal Canadian one might have trumped it, but that's...
In my mind, it is. Not everybody agrees with that, though.
Thank you for your message. We'll now take any questions.
Again, just a reminder, we'll take one question and one follow-up from reporters on the phone in the time allotted. We'll start with Mike Gorman from CBC. Go ahead, Mike.
Hi, Dr. Strang. It seems that there have been several dozen healthcare employees at the Cape Breton Regional, predominantly nurses, but also some doctors and some RTs, who have been required to self-isolate as a result of potentially coming in contact with COVID. I'm wondering two things. I'm wondering, number one, what the effect of taking that many people out of the system immediately does to staffing complement. And I'm wondering what's being done to guard against a similar glut quickly coming out of the system in the future.
So you're absolutely right. When we have healthcare workers who may have been exposed, we have to bring them out of the workforce and test them to make sure that they are not infectious. And we're looking at ways, and typically we would have people go on a 14-day isolation period. We are looking at ways that we could potentially get people back to work sooner with some very careful measures around monitoring temperatures, daily screening, et cetera. And so we're looking at those pieces because you're right. Having to pull numbers of people out of the workforce, whether it's in a hospital or in a long-term care facility, creates significant strain in our healthcare system and challenges the ability to deliver essential care. But we also have to make sure that we are not putting patients or co-workers at any increased risk of transmitting this virus through health by having healthcare workers who may be infectious continuing to work. So I said we are that the part of the reason that this has been done, or part of the plans on restructuring the healthcare system, if you will. So we have stopped a lot of outpatient visits, on elective surgeries, et cetera. Part of that is we can have a workforce that's focused as much as possible on urgent and emergency health issues as well as COVID. Gives us a bit more flexibility, anticipating that there are going to be healthcare workers who are exposed, perhaps even become ill, that we have to take out of the workforce. But it is an ongoing challenge, and we're looking at ways we can maintain people even if they've been exposed in the workforce in a safe manner.
Go ahead, Mike, with your follow-up.
Thank you, Dr. Strang. For the Premier, Premier, I've heard you say several times in these briefings that the province is working on and looking at other measures that it can do to help the homeless and the vulnerably housed populations. And in that time, we've seen Out of the Cold get some federal funding to put people in hotels, although I think they have acknowledged they could use more. We've seen Transition Homes say they need help to account for physical distancing, and we've seen marginalized communities such as the Prestons note that they've got vulnerable situations there, and they may need emergency housing help as well. When are we going to see a tangible and concrete plan from the province in terms of what it can do to help with what appears to be a growing housing demand here in Nova Scotia?
So thanks for the question. Each one of those will be different, as you've described. We've worked with HRM to open up some other shelters. My understanding they are on their way now. That would be through Department of Housing. Haven't worked with shelters in around domestic violence. There's now a proposal before the minister that came in to expand that. It's going through the process. And in any community, when we know that we're having to do particularly self-isolation, if we have to remove people from particularly family situations where it just may be one particular person that we're trying to self-isolate, we as a government are committed to working with all communities, and each one will be different on how we address those circumstances.
Next, we'll go to CTV's Natasha Pace. Go ahead, Natasha.
Hi there. Halifax Transit just confirmed that a bus operator has tested positive for COVID-19. My understanding is the person hasn't been in the workplace since April 4th, but I'm wondering, should riders be concerned at this point about taking public transportation in light of this?
So I'm not aware of the details of that case, simply because the driver or was a driver doesn't necessarily mean that they were exposed on the bus. Drivers, like the rest of us, live in our communities, and there's multiple ways we could be exposed. We have to understand. We continue to look at transit and be able to do that as safely as possible. But we also have to acknowledge that for a significant portion of our communities, buses are essential. We have people that need to get to work, and not everybody has the luxury of being able to drive, or it's short enough that they could walk. Other people, there's lots of families that they still need to get groceries, get things from the pharmacy, and for them the only way to do that is through a bus. So we continue to work to maintain buses and transit as an essential service, but doing that in a way that's as safe as possible.
Go ahead, Natasha, with your follow-up.
Thank you. Also for Dr. Strang, Northwood and Halifax has confirmed there are new cases of COVID-19 among residents there. For the last couple of days, my colleague has been trying to figure out the total number of nursing homes affected by the virus in the province. Is that something that you're able to disclose, like how many nursing homes across the province now have cases, whether it be residents or staff, of the virus?
So we're looking at ways we may be able to present all that from a provincial perspective accurately. This is a situation that changes every day, and that I don't want to bring forward information that's wrong or out of date. And in a big complex system, especially in the continuing care, where we have multiple homes, finding a way that doesn't take a huge amount of resources and people's time, that we can get this information to flow in and then be collated and reported publicly. So we're looking at that, but again, we want to make sure that we're focused on two key things: accurate information, but we also have to be cognizant about the information that we provide doesn't necessarily identify an individual and disclose information that needs to be kept private under privacy legislation. So we're continuing to work at that, and hopefully we'll be able to have something in the near future.
Next, we'll go to Keith Doucette from the Canadian Press. Go ahead, Keith.
Good afternoon, Dr. Strang. Question for you. I'm interested in the numbers today. I did a little math and I looked at the increase since April 1st. So a week ago from today, we've basically doubled the number of cases that we've had. And when you look at what we're reporting daily compared to our brethren in the rest of Atlantic Canada, we're basically dwarfing their numbers. I'm wondering, what's your take on that? Is that related to our increased and ramped up testing, or is there something else at play here?
So I think a lot of it, in both of those, we have to be cognizant that we may be having more disease activity, but also the number of positives you see actually is very dependent on your testing strategy. And we have, I really firmly believe that we have a very kind of gold standard of a testing strategy. We have lab capacity, we've opened up access, and that we're looking for COVID in Nova Scotia communities in a very aggressive way. The list of symptoms that I just talked about earlier, we're going to probably have lots of people that come forward to say a runny nose and a headache that we're going to be testing them. In normal times, we just say you probably have a cold, and most of them will turn out to be negative. But it's really important that we provide access to testing to those individuals to get the ones who may actually be COVID. So the testing strategy drives a lot of that. We also know that a lot of our new cases are coming from, and I talked to my medical officer of health team this morning, that there are strategy of when we identify close contacts, it's almost like 2 weeks ago now, we said we're going to start testing those people right away. Many of the positives that we're seeing now are contacts who are testing positive, but because we put them on self-isolation and testing them right away, they have minimal to no contact with the rest of their community, and they're a very uncomplicated case to follow up because they have not been spreading this virus in the community, which is exactly what we want. So my point is that, yes, a lot of what we're seeing, I think, is driven by our testing strategy, but it's the right strategy, and we're identifying a lot of cases who have not been exposing others in the community because of the other steps we're putting in place.
Go ahead with your follow-up, Keith.
Yeah, is there anything that you're doing that you're sharing or possibly strategy that you're sharing with the rest of the region in terms of just what you were talking about? Because it does seem like they're not nearly keeping up in terms of testing or what the results that they're producing, or maybe it is just that they don't have as many cases. I don't know. I guess we might find out through some of these modeling projections that are coming out. As you know, Newfoundland's doing theirs today. I might just get another one to ask you when ours modeling will be done.
I'll answer your first question first. So my Atlantic colleagues are participate on the Chief Medical Officer of Health calls that we have our Special Advisory Committee. We're on the calls together 3 times a week. I also had a separate call with my Atlantic colleagues just a few days ago to talk about all the things we're doing. I shared with them, what we're doing in our testing protocol. Each jurisdiction makes different decisions within the resources that they have in their jurisdiction. So things do look a little bit different across the country and within the region. But I'm very comfortable saying that we have in place what's necessary to be out front of this disease here in Nova Scotia. As for the modeling piece, we continue to work at that and hope to be able to bring something forward on that very soon.
Next, we'll go to Cassandra Nadeau-Lamarche, Radio-Canada.
Good afternoon. So this is for Premier McNeil. So many members of the Preston community were upset about your comments yesterday. They're saying that they are the ones who requested the assessment center and that it was not because of an outbreak or an increase of activity, but rather for prevention and to give the community better access. So is it the case?
So we've been working with public health. Dr. Strang and his team have been working, looking at the cases that we've had across the province. There have been areas where we've seen cases where we've gone in and began to work with the community, and the Preston community has been working with public health to ensure that we can increase the number of tests that take place in that community, and we will continue to work with them to ensure that we get as many tests as possible.
Go ahead with your follow-up. Go ahead, Dr. Strang.
Yeah, the decision on the assessment center, that was really a collaborative decision between certainly the community as we were working with them very early on, identifying the need for testing. They were identifying that they had a number of people in the community where access to testing was a challenge. At the same time, public health, we knew that about this community, and we were working with some solutions with the community. So it was not either or. I think both public health and the health system and the community were from the very beginning working together, understanding that there was a different solution for testing required for these communities.
Go ahead, Cassandra, with your follow-up.
Yeah, so my colleague Michael touched a little bit on that earlier, but the Preston community response team has asked for help, like more emergency housing for the community. So is that something specifically that you're thinking of providing for them shortly?
So public health, as I said, is in working with the community. We've said to them, put together the requests that are required. Housing is one of them. There's some other issues potentially that they may want to help support with. Of course, we'd be part of that. Our goal is what we've been doing across the province, where we see areas or unique circumstances, quite frankly, in other parts of the province where we may see a family that has a high spike of COVID in it, where we need to find a way to isolate them differently. So we'll work with that community, and we'll take the ideas that come out of the community, and we'll work at providing financial support to help them achieve, ensuring that we can get all the tests we can.
Next, we'll go to Lindsay Armstrong from all Nova Scotia. Go ahead, Lindsay.
For Dr. Strang, in BC and Ontario, they've looked at addressing the concern of long-term care workers who work in multiple facilities and may potentially spread COVID in that way. Are there long-term care workers in Nova Scotia moving between facilities?
So we do have, historically we have and continue to have some long continuing care workers who work in multiple facilities. That's a critical piece of how we continue to staff long-term care or continuing care facilities. We can't remove that entirely, but we're working as best as possible to come up with solutions that will allow a worker to work in one facility and one facility only. But we have to balance that with making sure we have essential staffing so residents can receive the necessary care they have, or that they have to have.
And Dr. Strang, yesterday you said about 10% of our total cases are under investigation and are assumed to be community spread. How many of the recent cases are potentially community spread? Of the 32 announced today, how many are not linked to travel?
So I don't have that breakdown. What I have is the breakdown historically of all our cases, and it remains about 10% of those. So 90% are related to travel or contact with a known case. what we're seeing more recently is that more and more of even though there may be a contact of a known case, that known case may well be from spread in the community, and we have more of our cases, our recent cases, that are under investigation where it's not as clear cut that there's a clear explanation for there, and therefore we may end up concluding that there is community spread. What we do know is that while we said there is evidence of community spread, that there is not wide community spread, except where the communities in the Prestons and Cherrybrook that we talked about yesterday. And that's not a reflection on those communities. It's just an honest, truthful reflection of where there is active disease within a part of our province. So we continue to monitor where new cases are occurring and where there may be indications of increased likelihood of spread within communities. And those are the places, as I've talked about the last few days, where we will bring in enhanced testing to support those communities to better understand where there is active community transmission and how we get our hands around that. One of the key pieces is knowing who's positive, getting them isolated, knowing who their contacts are, testing them and getting them isolated. So it is about working very closely with communities, understanding, looking at the epidemiology and what our new cases are. That is different than what we present in some of our public and what I talk about overall, our total number of cases. But also, as I said earlier, many of our cases are also the contacts. We're now seeing the benefits of our strategy of testing contacts right away, and many of our new cases are those positive contacts who, because of our other steps, have kept them from spreading it out into the community.
Next, we'll go to Jesse Thomas from Global. Go ahead, Jesse.
Thank you. This is a question for Dr. Strang. Just while this press conference began, a public service announcement went out about the transit driver being testing positive for COVID-19. I guess I'm just wondering, from a public health perspective, the union's talking about concerns with crowding on buses and cleaning measures. I guess from a public health perspective, what are your concerns? Are you guys looking to implement any other safety measures as we keep hearing issues about buses?
So this is a good example, actually, of what I talked about earlier, where I can come forward with information and knowledge of cases up to a certain point. A late-breaking story like that, I'm going to have to go back and find out more about this and what are the implications for transit. But I will say again, I would remain very concerned that we have a significant proportion of our community that transit is an essential service. So how do we keep that going as safe as possible? But I can't speak specifically to the case that you're bringing forward because, as you said, it's late breaking, and I haven't had time to kind of delve into that with my team.
Go ahead, Jesse, with your follow-up.
Okay, I guess it wasn't specific to the case. I'm asking what the public health concerns would be around this ongoing issue of crowding on buses and just passenger and driver safety from a public health perspective. What are your concerns, and I guess how do we address this?
So we have to find a way. We have to find a way that transit can be maintained as an essential service. If there's things we need to do to enhance that safety, where we can look at that. And I know there are some concerns from drivers around that. But like healthcare workers, they are essential in our community. So how do we actually work? We can figure out other ways to do that. Some other jurisdictions have put limits on the number of people can get on a bus. That's something that we could consider. However, I do have. What about if you're the person whose only way to get to work is on the bus, and you're always at the end of the line? You never get on the bus. So there's some challenge right there, and we have to balance safety on the bus versus the essential need for many in our community to use a bus.
Next, we'll go to John McPhee from the Chronicle Herald. Go ahead, John.
This is a question for Dr. Strang. Just regarding the expansion of screening criteria, if it could come down to that you have a runny nose and a sore throat, that's going to be a lot of people. Do we have the 811 staffing in place to deal with a big increase in screening?
So we were talking about making this change late last week, and 811 and our assessment centers and the lab have worked to build their capacity. They have repeatedly assured me that they feel they have the capacity, and quite frankly, they've said to me, we're up for the challenge of testing as many Nova Scotians as necessary. We'll monitor the volumes and we'll support that as best we can. But our primary priority is to test Nova Scotians as necessary because it's critical to our strategy of being able to minimize the spread of this disease.
Go ahead, John, with your follow-up.
Yeah, thanks. Just on the expanded screening again, in terms of if we're going to be screening that increase in people, like a lot more people, are you expecting to see a lot more positives come up? Do you have a sense of the numbers that we might be seeing? You know, people may be concerned if we really see a big increase in positives because we've expanded the screening so much.
I certainly anticipate that as we test more people, we're going to get more positives. All the indications are that we have is that even though we talk about community spread, it is not wide community spread, except in, as I've talked about, in kind of one area of the province. And so I anticipate that we're not likely to see a huge increase in positives, but I am certainly expecting, and the public should expect to see the more people we test, the more positives we'll find. But that's a good thing. It'll show us the extent of community spread that we actually have, which then and how do we deal with that. But testing people, again, there's two key strategies to dealing with this disease. One is the public health measures that keep people at home apart from each other, and the second one is identifying cases as early as possible so they haven't been out in the community spreading it around for days and days. And then once we identify them, isolating them, and also identifying and testing their close contacts, because that's how you rapidly, aggressively can contain this disease, by identifying people who are infectious and all the people that they've been in close contact with, and wrapping a circle of isolation around them, if you will, to minimize the disease spreading further in the community.
Next, we'll go to Nancy King from the Cape Breton Post. Go ahead, Nancy.
Dr. Strang, we've been told that the patient who died at the Cape Breton Regional Hospital initially tested negative for COVID-19 and was kept in a non-COVID unit as a result, and that's why so many patients or so many staff members have now been asked to self-isolate. Just wondering if you can confirm that initially the patient tested negative?
That is my understanding. A test was done. The test came back negative, and therefore the people felt that the person wasn't infected. The test was repeated because of a change in the individual's status, which came back positive. As a result of that, there's my understanding this morning that there's been a directive in the health authority that anybody that has suggestions of respiratory illness, that COVID precautions need to be maintained around that individual, even if an initial test may come back negative. There are medical reasons why somebody may test negative. If they're very early on in the disease, they may have what we call a very low viral load, so not a lot of virus in their upper airway the nose and throat, where we take the swab from. The other reason is that if people have a disease in their lungs and the disease is deep in their lungs, they may well not have actually the virus in their nose and throat, and so a swab from the nose and throat may not detect somebody who's got more advanced disease in their lungs. So for those reasons, it's not. We have to be aware that there's potential for a negative test, and that is the reason the directive now from the health authority that anybody where there's a suspicion of respiratory disease related to COVID gets put on and is maintained on the appropriate precautions, even if the initial test may be negative.
Go ahead, Nancy, if you have a follow-up.
And do you have any percentages for the number of possible false negative tests that you might be getting back?
So in discussion, so the case that I talked about in the hospital, those are fairly unique circumstances, and that's a fairly unusual situation. Certainly in my conversation with the lab is that the test we're using for people with mild symptoms out in the community that we swab for their nose and throat, it's very accurate. It'd be very unlikely to get a negative test from that swab. What sometimes is confused as a negative test, where somebody, say you just had a fever and a headache and you were tested and tested negative, and then 3 or 4 days later you may get sick with some other symptoms and you come back and get tested again, and you test positive the second time. It doesn't mean the first test was wrong. It means that you didn't had COVID at the time of that first test, and then you've been exposed in a few days to COVID, and you've gotten sick again, and then you come back and have positive. I've had that question a number of times, and people say, well, the first test was wrong. It just means no, you didn't have COVID the first time you were tested. With the symptoms we have aren't specific to COVID at all. There's lots of other viruses that can give you those symptoms. So you had another virus the first time, and then you got sick again, and now this time you've gotten COVID.
Next, we'll go to Tim Bousquet from the Halifax Examiner. Go ahead, Tim.
Hi, thank you. Dr. Strang, earlier this week, or I guess Sunday, you announced that you would have a directive about long-term care homes and how they were to go about things. That order was published on Monday. I noticed that it applies only to homes regulated by the Department of Health, which is typically the nursing homes. I'm wondering why that order did not extend to congregate care homes managed by the Department of Community Services. Shouldn't people with disabilities that live in those homes be accorded the same protection as elderly people?
So we continue to work with those homes to support them as necessary. You have to understand that a lot of the directive is associated with levels of nursing care. The type of homes that you're talking about don't have those level of nursing care, and actually many of the directives wouldn't be applicable to those kind of institutions because of the type of care that is delivered there. Also, many of the individuals in these homes don't have, because of the age or underlying health conditions, aren't at the same level of vulnerability. They are certainly vulnerable. Please don't get me wrong, but they don't have the same level of vulnerability as many of our frail elderly. So we're continuing to work with those residential care facilities to support them to be able to apply the necessary protections for residents in that setting. It's a different setting than a long-term care facility setting.
Go ahead, Tim, with your follow-up.
Yeah, Dr. Strang, thank you. I have a question about epidemiology, I suppose. These restrictions, obviously, they're needed to stop the spread of COVID, and that will save lives. But the restrictions themselves, have your people done modeling in terms of what the increased mortality might be for things like mental health, suicide, self-harm, substance abuse, the lack of physical health, a drop in nutrition, the number of people who would be going to the hospital just routinely, and the doctor might catch some potentially deathly illness that wouldn't be presented otherwise. Do you have numbers on stuff like that?
So no, we don't have numbers of that in the province. That's certainly at a national level. People have raised that as how do we I guess start to measure some of the health impacts of these restrictions. And you're right to point out there are some challenges here. But the restrictions that we have are absolutely necessary. I'll come back to the comment that I made yesterday. If we didn't put these restrictions in place, we would have a huge spike in COVID-19, and then it would be over with in a relatively shortish period of time. But that huge spike would cause hundreds of preventable deaths, not just directly from COVID, but there would be lots of people that would die because the healthcare system would be overwhelmed, and their heart attack, their chronic disease would not be able to be managed by the healthcare system, and then we would have deaths occurring from that. recognizing that there are implications and negative health implications potentially from the measures that we're putting in place. And we're working at what, we have to, that's why we're trying to sustain the other parts of our healthcare system to help people out with those challenges as best we can. But it's a necessary choice to prevent or to avoid those very preventable hundreds of deaths that would occur that if we didn't put these measures in place.
Next, we'll go to Daryl Cole from the Amherst News.
Questions for the Premier. Mr. Premier, over the last few days, Amherst police have been ticketing motorists who are coming across the Nova Scotia border and not self-isolating. I know 3 charges were laid on Monday as part of a focused enforcement effort in which motorists were seen coming into the province and going to stores. The question I have is this: Amherst has traditionally been a location people in the Sackville-Allac region come to buy groceries. Are they in contravention of the order if they're coming into Amherst to buy groceries, which would be an essential?
Yes, they would be. If they're coming in, going to a work site where they are working and going back and sleeping at night, that has been permitted by the order. But if you're coming out into public, we're encouraging them to shop in their home province.
Go ahead, Daryl, with your follow-up.
So the supplementary question is, essential workers and people who are healthy going to work in Nova Scotia from New Brunswick, if one of those workers stops at a store either on the way to work or the way back from work, again, are they breaking the order?
We expect them to come in and go directly to work and go home. Listen, this is a permission for them to be able to come across to go to work, to continue to keep that particular workplace moving, to help keep some parts of our economy going, but then we expect them to go directly home.
That's all the time we have for questions today. Go ahead, Premier.
Thank you, Tina. As you heard from Dr. Strang, we have reached an all-time one-day high of 32 cases today. We've expanded and broadened our testing, which means we are catching more positive cases, including the mild ones, and that's good news. The bad news is that COVID is in our communities, and that's why everyone, no matter where you live, no matter your race, no matter your religion, everyone must follow public health protocols. The virus does not discriminate, and if you do not follow the rules, it will follow you. Nova Scotians are not immune to the deadly nature of COVID-19. Keeping your distance and staying inside, that is the only way that we will be able to flatten the curve. Almost 4 weeks in, I know how hard it is to be stuck indoors. The weather is getting better. The novelty of puzzles and board games and family fun is wearing thin. To moms and dads and primary caregivers, I know how hard this is for you. You're trying to keep your children entertained. You're trying to turn your kitchen into a classroom. In the middle of all of that, some of you are trying to work from home. And most of all, you are trying to keep your kids indoors. This is a tough job, and I'm sorry that you're having to deal with this, but Dr. Strang and I need your help. You have the most important job, loving and caring for your children. And now we've added to it by asking you to help them understand what some of us are having trouble to understand. It's hard in the spring to tell your kids they can't go outside. It's the very thing we as parents look forward to after a long winter, telling our kids to get outside and burn off some of that excess energy. But you can't do that, not now and not for a while. Thank you for all that you do every day, and I'm now asking you as primary caregivers to dig deep, stay focused, stay safe, and protect your children.